Hello everyone, welcome back. For this session, we're going to talk about some common disorders of female reproductive system. In the first section, we will have a quick look at the main causes of female reproductive disorders, and in the following 4 sections, we will respectively discuss some common disorders of vagina, uterus, fallopian tubes, and ovary. Do you have ever experienced abdominal pain, burning urination, genital itch, or abnormal vaginal discharge or bleeding? If you have one or several symptoms, then you'd better pay attention because you will see what causes those problems and how to treat them. Different kinds of diseases and disorders are associated with the female reproductive system. These kinds of disorders might arise either due to some infection or some abnormalities within the organs. The abnormal release of hormones is also often associated with these disorders. In addition to these causes, sometimes the diseases in other organs might also cause different disorders in the female reproductive system. When you feel the itch, irritation, and pain of vaginal area, your first thought is likely of a yeast infection. But other common disorders can cause similar discomfort. Some disorders are contagious and others are not. Either way, knowing the signs will help guide you in treating them. Let's start with bacterial vaginosis. It is a type of vaginal inflammation caused by the overgrowth of bacteria naturally found in the vagina. Usually, the good bacteria, lactobacilli, outnumber bad bacteria, anaerobes. But if there are too many bad bacteria, they will upset the natural balance of microorganisms in the vagina and cause bacterial vaginosis. Signs and symptoms of bacterial vaginosis may include thin, gray, white, or greenish vaginal discharge, full-smelling, fishy vaginal odor, vaginal itching and burning during urination. But many women with bacterial vaginosis can have no signs or symptoms. Risk factors for this kind of disorder include 1. Sexual activity. 2. Douching. The practice of rinsing out vagina with water or a cleansing agent, douching, may upset the natural balance of one's vagina. This can lead to an overgrowth of bacteria and cause this condition. Since the vagina is self-cleaning, overdouching isn't necessary. 3. Natural lack of lactobacilli bacteria. In order to treat bacterial vaginosis, the doctor may prescribe antibiotics. Candidiasis is an infection caused by a yeast or fungus called Candida albicans. Candida normally lives inside the body and on skin without causing any problems. Sometimes Candida can multiply and cause an infection if the environment inside the vagina changes in a way that encourages its growth. This can happen because of hormones, medicines, or changes in the immune system. Candidiasis in the vagina is called Candida vaginal infections. The symptoms of Candida vaginal infections include 1. Vaginal itching or burning. 2. Pain or discomfort when urinating. 3. Abnormal vaginal discharge. Women may have no discharge, a scanty white discharge, or the typical cottage cheese-like discharge. Women who are more likely to get Candida vaginal infections include those who are pregnant, who use hormonal contraceptives, people who have diabetes, people who are frequently infected by malaria, or have a weakened immune system, or who are taking or have recently taken antibiotics. Then how to treat candida vaginal infections. For most infections, the treatment is the antifungal medicine applied inside the vagina, or a single dose of fluconazole taken by mouth. Trichomonas vaginalis is a very common sexually transmitted disease. It is caused by infection with a parasite called Trichomonas vaginalis. About 70% of infected people do not have any signs or symptoms. When it does cause symptoms, they can range from mild irritation to severe inflammation. Symptoms can come and go. Women having symptoms may experience itching, burning, redness or soreness of the genitals, or discomfort with urination, or a change in their vaginal discharge that can be clear, white, yellowish, or greenish, with an unusual fishy smell. Risk factors of this condition include having multiple sexual partners, or having Trichomonas vaginalis previously, or having unprotected sex. Also, douching removes some of the normal bacteria in the vagina that protects you from infection. This may increase the risk of getting STD. This condition can be treated with antibiotics. A number of medical conditions can affect the uterus and cause pain, such as fibroids and cancer. Accompanying symptoms of different uterine conditions are similar and may include irregular menstrual bleeding and difficulty getting pregnant, so it's important to know some common disorders of the uterus. Cervicitis, which indicates an inflammation of the cervix, is mainly classified into two types, acute cervicitis and chronic cervicitis. Acute cervicitis is the sudden onset of inflammation of the cervix. The signs and symptoms of acute cervicitis include frequent urination, itching in the genital area, pain during intercourse, abnormal vaginal discharge or bleeding, and pressure in the pelvis. Chronic cervicitis is the chronic or persistent inflammation of the cervix. In some women, no signs and symptoms are noted. In other women with signs and symptoms, they may have 1. Swelling and redness of the cervix, 2. Ulceration, 3. Abnormal vaginal discharge, 4. Increased frequency of urination, 5. Itching in the genital area, 6. Pain during intercourse, 7. Pressure in the pelvis. Even though acute cervicitis can be caused by many factors, it is usually caused by an infection. Acute cervicitis generally manifests with obvious signs and symptoms, such as lower abdominal pain, chill, or fever. This is the time you seek for immediate medications. The treatment of acute cervicitis depends on the cause of the condition. If bacteria are the cause, antibiotic medication can be used. If viruses are the cause, antiviral medication could be applied. When allergies or irritation is the source of inflammation, no treatment is needed. Acute cervicitis may resolve spontaneously after the source of irritation or inflammation is removed. If the cause is sexually transmitted, treating the partner is also important. However, chronic cervicitis are mostly due to unknown infectious causes. Acute cervicitis that is left untreated or treated inappropriately for a long time can also result in chronic condition. Non-infectious causes of chronic cervicitis include 1. Allergies 2. Irritation 3. Recent surgeries and radiation therapy involving the cervix 4. Injury to the vagina 5. Cervical polyps 6. Presence of Nathovian cysts. Infectious causes are mainly chronic bacterial infections, sexually transmitted infection, viral infections. The treatments are quite similar to the treatment of acute cervicitis, with 2 more added. 1. If the cause is due to a non-infectious agent, symptomatic treatment of the signs and symptoms is needed. 2. Surgical treatment. Since antibiotics and antiviral medication cannot be used for long. Greenworld has some products work as natural antibiotics, such as propolis plus capsule, aloe vera plus capsule, garlic oil capsule, and chitosan capsule. Cervical cancer is a type of cancer that occurs in the cells of the cervix. It is the 4th most commonly occurring cancer in women all over the world. Women tend to have cervical cancer after HPV infection, but other factors, such as the environment or lifestyle choices, also determine whether one will develop cervical cancer. The risk factors for cervical cancer are 1. Many sexual partners 2. Early sexual activity 3. Other sexually transmitted infections 4. A weakened immune system 5. Smoking. Those factors would increase one's risk of HPV infection. Early-stage cervical cancer generally produces no signs or symptoms. Symptoms of more advanced cervical cancer include vaginal bleeding after intercourse, between periods, or after menopause, and watery, bloody vaginal discharge, pelvic pain, or pain during intercourse. Treatment for cervical cancer depends on several factors, such as the size and the stage of the cancer, other health problems she may have. Usually, surgery, radiation, chemotherapy, or a combination of the 3 may be used. Endometritis is an inflammation of endometrium caused by a bacterial infection. Possible risk factors include 1. Childbirth or miscarriage 2. C-section 3. Sexually transmitted infections and other bacteria 4. Bacteria in the uterus 5. Pelvic surgery 6. Pelvic inflammatory disease. Symptoms of endometritis may include 1. Pelvic or abdominal pain 2. Vaginal bleeding or unusual discharge 3. Fever or chills 4. Feeling unwell or extremely fatigued 5. Constipation or pain when going to the bathroom. Treatment of this condition aims to remove infection and inflammation from the uterus. These may involve 1. Antibiotics 2. Evacuation to remove the tissues left in the womb after giving birth 3. Needle aspiration to drain an abscess in the abdomen 4. Surgery to remove pus and infected tissue. Uterine fibroids are non-cancerous growths of the uterus that often appear during childbearing years. As for the causes, they are 1. Genetic changes 2. Hormones 3. Other growth factors, such as insulin-like growth factor. 4. Extracellular matrix. Factors that can have an impact on fibroid development include 1. Race, 2. Heredity, 3. Other factors, including obesity, a vitamin D deficiency, etc. Many women having uterine fibroids show no symptoms. In those that do, symptoms can be influenced by the location, size, and number of fibroids, which include 1. Heavy menstrual bleeding, 2. Menstrual periods lasting more than a week, 3. Pelvic pressure or pain, 4. Frequent urination, 5. Difficulty emptying the bladder, 6. Constipation, 7. Backache or leg pains. Based on the number, size, and location of the fibroids, the age of the patients, doctors may choose hormonal therapy, non-invasive measures, or surgery to remove part or the whole of the uterus. Endometrial cancer begins in the endometrium. This cancer occurs when genetic changes cause cells to start growing out of control instead of dying at the expected stage of their life cycles. Factors that increase the risk of endometrial cancer include 1. Changes in the balance of female hormones in the body, 2. More years of menstruation, 3. Never having been pregnant, 4. Older age, 5. Obesity, 6. Hormone therapy for breast cancer, 7. An inherited colon cancer syndrome. Signs and symptoms may include vaginal bleeding after menopause, bleeding between periods, and pelvic pain. Treatment for endometrial cancer is usually with surgery to remove the uterus, fallopian tubes, and ovaries. Radiation therapy with powerful energy or chemotherapy with powerful drugs, and hormone therapy may sometimes be applied. Problems with the fallopian tubes account for a significant percentage of infertility cases. Sometimes the tubes may be blocked, or they may be scarred as a result of disease or infection. Fallopian tube infection is a type of pelvic inflammatory disease and is most commonly caused by sexually transmitted bacterial infections. Lifestyle factors that greatly increase a woman's risk of getting this condition include 1. Unprotected sexual intercourse, 2. Infected with a sexually transmitted disease previously. Common symptoms include fever, unusual vaginal discharge, frequent urination, nausea, vomiting, lower back pain, pelvic pain, as well as pain during menstruation and sexual intercourse. Treatment for this condition generally depends on the severity of the infection. In mild cases, antibiotics are usually prescribed. If the infection has resulted in the development of a collection of pus or fluid on the fallopian tube, surgical drainage may be acquired. Similarly, if the infection has caused scars or adhesions of the fallopian tube, surgical repair may be necessary in order to avoid infertility. When an obstruction prevents the egg from traveling down the tube, a woman has a blocked fallopian tube. The majority of blocked fallopian tubes are caused by pelvic infections, and most of these infections are caused by a sexually transmitted infection. It's unusual for women with this condition to have any symptoms. If there is any, then the first symptom of blocked fallopian tubes is often infertility. If both tubes are blocked, surgery to reopen the fallopian tubes or in vitro fertilization could be a choice. Once an infection has been detected, quick antibiotic treatment is important. Chronic infection may need the assistance of Greenwald products for relieving inflammation mentioned before. In last session, we know that the ovaries produce and store a woman's eggs, and they also make the female hormones. Here we will talk about two kinds of common disorders of ovaries, namely ovarian cysts and ovarian cancer. Ovarian cysts are fluid-filled sacs or pockets in an ovary or on its surface. Most ovarian cysts develop as a result of menstrual cycle. Other types of cysts are much less common. The risk factors of developing an ovarian cyst are 1. Hormonal problems. These include taking the fertility drug Clomid. 2. Pregnancy. 3. Endometriosis. 4. A severe pelvic infection. 5. A previous ovarian cyst. Most ovarian cysts present little or no discomfort and are harmless. However, some ovarian cysts, especially those that have ruptured, can cause serious symptoms. A large ovarian cyst can cause 1. Pelvic pain, 2. Fullness or heaviness in the abdomen, 3. Bloating, and if you have sudden, severe abdominal or pelvic pain, or you have pain with fever or vomiting, go and see a doctor immediately. Treatment of this condition depends on the age, the type and size of the cyst, and the symptoms, which include watchful waiting. If you have no symptoms and an ultrasound shows you have a simple, small fluid-filled cyst, medication, hormonal contraceptives may be recommended to keep ovarian cysts from recurring. Surgery may be needed if a cyst is large and is growing or causes pain. Ovarian cancer begins when healthy cells in an ovary change and grow out of control, forming a mass called a tumor. Factors that can increase the risk of ovarian cancer include 1. Older age, 2. Inherited gene mutations, 3. Family history of ovarian cancer, 4. Estrogen hormone replacement therapy, 5. Age when menstruation started and ended. Early-stage ovarian cancer rarely causes any symptoms. Advanced-stage ovarian cancer may cause few and non-specific symptoms. Signs and symptoms of ovarian cancer may include 1. Vaginal bleeding or abnormal discharge, 2. Pain or pressure in the pelvic area, 3. Abdominal or back pain, 4. Abdominal bloating or swelling, 5. Quickly feeling full when eating, 6. Weight loss or gain, 7. Changes in bowel habits such as constipation, 8. A frequent need to urinate. Treatment of ovarian cancer usually involves a combination of surgery and chemotherapy. Operations to remove ovarian cancer include surgery to remove one or both ovaries, even with the uterus. If your cancer is advanced, your doctor may recommend chemotherapy, followed by surgery to remove as much of the cancer as possible. So, prevention is always more important than cure. In the following sessions, we will present the products for uterus cleansing, for kidney care, and for hormonal balance. That's all for today. Maybe you will feel bombarded with all this information. Don't worry, if you have any questions and doubts concerning your health, you can always go for the professionals for advice. The main purpose for us being here today is to help you create health awareness and have a general knowledge of common disorders, symptoms, and treatment concerning female reproductive system. Next topic will be kidney care, which helps us understand the relation between health of kidney and reproductive system.